guys, so I'm here to update you on Nolan's health. I have been getting so many questions and comments concerning Nolan's health since I put up the not so good news video, and I just want to say a huge thank you for everybody that has commented saying, you know, they're thinking about Nolan, they're praying for Nolan, you know, Nolan is in their thoughts. I just want to say thank you so much from the bottom of my heart, because I have gotten so many comments and people that are here to support us and have just been there for us, and I will be forever grateful for that. I have like this huge family and army behind me that's here to always support me. You know, even though you guys see me and I don't know what you guys look like and we've never met, you guys are a huge part of my life and everyday life. And I think Nolan just came in, or Ian just came in the door. Sorry about that. Ian just walked through the door and I'm still like uncomfortable filming in front of him. I know, that's weird. I've been doing this a while, but yeah, I just wanted to say thank you guys so much. And this video, I am going to be covering so much and all the little details that I have been leaving out over the past few weeks that a lot of people have been wondering about and wondering if he's okay, if he's sick, or you know, what is going on with Nolan. So I'm going to cover a lot of that in this video, but I will say that some of it not that I'm leaving out, or some of it is still unknown, and you'll get what I'm talking about here in a minute. So a lot of it is still unknown as far as what is really going on with Nolan, but we are getting more and more answers, and I'm kind of gonna explain all of that. So I'm just gonna go ahead and get started with this video and let you know everything that's been going on with Nolan, because I know a lot of people have been new, so I might briefly cover a little bit of the backstory. And you know, a lot of people already know like what's going on with his doctor visits and everything, not the recent specific details, but I'm just gonna go ahead and cover that. Oh, I hate when I do these long intros. Sorry for the background noise. Aria is coloring and Nolan's just kind of like walking around, so if you hear any noise, that's what's going on. But if you've been watching for a while, or if you haven't, I'm pretty sure a lot of you know that Nolan was born with only 4 fingers on his left hand, and this has nothing to do with what's going on. I will be talking about his surgery as well in this video, so that's kind of why I'm bringing that up. So long story short, when we went in for his 12-month appointment, they did some blood work on Nolan, and it came back that his white blood cells were elevated as well as his blood count. So yeah, his white blood cells were elevated, his blood count was elevated, and they wanted us to come back in 2 weeks and test again, and it was still the same. So then that's when we got referred to a hematologist. So then when we saw the hematologist, we got more testing done, and they tested for different things. That's why we were going back every single week, because they kept testing and testing and testing more. I think a lot of people are confused when it comes to blood tests, that there's not just like one specific test to get done to check a whole array of things. There's just specific tests, like different blood tests that you can get done. It's not just like one big thing. That's why he had to keep going back for more testing to find out, well, if it's not these list of things, then let's do another test and see if it's this list of things. That's kind of how it worked. So when his liver enzymes came back high, the doctor thought, or the hematologist thought, well, maybe he has inflammation on his liver. So we actually got a liver ultrasound that came back normal. She did more testing, and this is the part where I talked about him having this very specific blood level, very elevated, not normal at all. And it came back that his CPK, I will leave the technical name because that's just the abbreviation, I can't pronounce it, creatine phosphate, I don't even want to attempt it. There has been a lot of different medical terms I've had to learn and try to pronounce, but that is one that I have such a hard time saying. So his CPK levels came back in the 10,000s, which is very high. And a lot of people might not be familiar with CPK levels. I mean, I know I wasn't. It has something to do with his enzymes in his muscles, well, his skeletal muscles as well as his heart, and also what is the other one? Oh, and his brain. That's right, the heart, brain, and skeletal muscle. So that came back really high, like I said, in the 10,000s. So that's when we got referred to a neurologist, because the hematologist thought that, well, when those levels are high, there's something going on with the muscles, and usually it's a muscular dystrophy. So that's when we got referred to a neurologist, because that is within her specialty and she doesn't know much about muscular dystrophies. And we went to go see the neurologist, and we didn't get any testing done there because he had already had the blood work. We mainly just talked to the neurologist. He says that when these levels are so high, it suggests a muscular dystrophy. Now, like the two main or common muscular dystrophy is called Becker dystrophy and Duchenne, which is DMD for short. So the neurologist did go over with me what DMD was as well as Becker dystrophy, and he says the more common dystrophy between the two is Duchenne, which is more severe. He said that it's a genetic disorder passed through the female. Usually only boys have it. Very rarely girls will have DMD. And also that typically it starts happening around the age of 3 and 5. Between 3 and 5 is when they'll notice that kids will start to have trouble standing up and walking, and usually by 13 years old they will be wheelchair bound for the rest of their life. So this was a lot to take in as the doctor was telling me this, because I mean, who wants to hear that your child is going to be wheelchair bound by the age of 13, also have respiratory problems. They die very young because of respiratory and heart problems. Life expectancy is low. Now, there is no cure for DMD, but you can have treatment options like steroids, and it can kind of prolong the process of your muscles and everything and like that. So he said that Duchenne is it's a very common muscular dystrophy, and Becker is also another one, but it is less severe. They usually don't start having muscle weakness until later on in life. So he said that Nolan could have either one of those, or he could have a more rare kind of dystrophy. But since those two are the main ones, he was pretty sure it would have been either one of those. So we did get more testing done, and you know, those few days were so rough for me, because you know, I was looking into it, I was, you know, looking into all the information, and you know, I was panicking because it is genetic. So that means that future children, future boys could have this, and Aria can also be a carrier for it, because females are the carrier. So it was just, there's just so much, there was a lot to take in, and we actually just got the call today that he doesn't have DMD. So that is definitely a huge relief. But since he tested negative for DMD and Becker, this means that he could have even a more rare kind of a dystrophy, because his CPK levels are so high. It is not normal at all, and there's definitely something going on with that. So I talked to the genetics counselor today, and she said that this is not common at all, and we're gonna have to do more testing. So we're going in tomorrow morning. She wanted us to get in as soon as possible and get those tests sent over, because they have to ship them overnight. They have to FedEx them overnight, and they have to do the testing out of state. We're going tomorrow morning to get more blood. Also, something came back positive in his urine. I don't want to say what it is right now, because I'm still a little confused about it myself, so I'm going to talk to the geneticists tomorrow. And so we had to get more urine for him as well, and he has to fast tomorrow morning for about a few hours, they said. So I feel like I just like spit out so much information to you guys, but that is what's going on with Nolan. That's why it was so, sorry, my phone's going off. But that's why it was, when after seeing the neurologist, it was a lot to take in. It really did shake our world, because we have been worrying about Nolan so much. I have been so paranoid. Every time he falls down, I'm thinking, oh my gosh, is this like the early stages of his dystrophy? He's like, because Nolan he is quite clumsy, and you know, it could still be. We do not know what is going on until we get more testing. And the thing about genetic testing and specific testing that he has done is that it can take anywhere between 4 and 6 weeks. That's why I have been so quiet and not said anything, because I was not 100% sure myself, and I was waiting for the blood results. So it is definitely a waiting game, and that whole time you are worrying. But it's just like a huge relief to know that he does not have DMD. But at the same time, now I'm worried that he can have even a more rare dystrophy. And I don't know what those pertain to because I only knew about the 2 common ones. I don't know about the other ones. It's something I'm gonna have to look into. But I will definitely keep you guys updated along the way because I know a lot of you guys have been concerned with Nolan and you guys really care about our family, and I definitely want to keep you updated. I just don't want to, I know a lot of people got upset with me because I wasn't saying anything, but I don't want to mention it if I don't really know what's going on myself. You know, I don't really want to put that out there if I don't know 100%. Also, with Nolan's surgery, his hand surgery, he is getting hand surgery. I did a video, an update video. I might leave all those links below. If you're new to this channel and you kind of don't know what's going on, I will leave the video about his thumb surgery, the thumb polization, and all the information about that. So as of today, Nolan is getting his hand surgery on January the 8th. I don't know if I'm gonna do a separate video about it. I kind of just wanted to briefly talk about it now since I'm going ahead talking about Nolan's health, and I'm probably leaving out so much that I want to talk about, and I'm trying to make this video as short as possible, but there's just so much to talk about, and Nolan is getting antsy and wanting to mess with the tree. What are you doing? You better leave the tree alone, you little naughty boy. Yeah, like I was saying, he's getting hand surgery on the 8th. I've actually been having to go, remember I mentioned in a vlog that I've been having to go to different doctors and get those results because the surgeon wants to know what's going on. And the last thing that we needed the results from was the geneticist because the surgeon wanted to make sure he didn't have a certain anemia, which I will also leave right here, which he doesn't. His levels came back normal for that, so that's a relief. I just have to get those tomorrow when we go for the blood work, and I have to send off all those results to the surgeon. So I just feel like a cloud has, like a dark cloud has lifted in a sense. I feel like relief, you know, I'm getting all these tests to get into surgery. His surgery's coming up, we're getting that all squared away, and you know, we're finding out good things and some concerning things, but on the other hand, there's still this big unknown that we still need to get answers for. I kind of just wanted to put out this video to kind of let you know what's going on. Nolan, no! Just to kind of let you know what's going on. Since I know more now, there's still more that needs to be found out, and like I said, we're getting blood tests tomorrow, and I will definitely keep you guys updated along the way. And the next time I do a video about Nolan's health, it'll be for sure what he has, because I'm not going to keep doing videos if they can't keep finding out what's going on. I just hope that I can get answers soon. I just want a peace of mind to know, like, you know what, if he has this, at least we know what it is. Just knocked down an ornament. At least we know what it is and we can deal with it now, and treatment options and all that kind of stuff. We can go about it now. We're kind of just left up in the air because we still don't have all the answers we need. We got some answer that he doesn't have certain things, but also there's other things that he could have. And then there was another thing that came up with his urine, with his enzymes. So it has just been a lot on our family. So many appointments, so many blood tests. And you know, we're having to go through the ringer again tomorrow with that. And it's been a tough time. It's been a tough time. And you know, with his upcoming surgery and all of that, and thinking about that and getting that squared away. I don't even know where I left off. I had to hurry and get up because Nolan started drawing on the walls with the crayon. This is what happens when I try and no. Yeah. You say hi?
Hi.
You say hi. Aria wants to say hi too.
Hi.
Look at my babies.
I want to talk.
You want to talk? What do you want to say?
Nolan's my brother because we got a Christmas tree. And
so my camera totally died in the middle of me talking, probably because I've been talking so much in this update video, but there was just so much information to cover. And you know, as far as like how I'm doing, I'm trying to stay as strong, as positive as I can. You know, I try not to think about it too much on what's going on with Nolan, but I know in the back of my mind, you know, it's there and I'm not in denial or anything. So I definitely want to keep you guys updated and let you guys know what's going on. And I just want to say thank you for the people that understood, you know, not putting out the details as soon as I got them. Look at Nolan. Nolan, I don't think you can fit through there, buddy. This video is a medical update as well as what it really is like to have 2 little ones and try and film a video. But yeah, I'm just gonna go ahead and end this video. If you guys have any more questions regarding Nolan and what's going on that I didn't cover, because I probably did leave out something, but I just want to say thank you guys so much for watching, and I will see you guys in my next video. Is there something you want to say?
Bye, guys.
Say bye, guys. Oh my goodness, you got a mouthful of goldfish, girl.